Happy Senior Saturday. This is Jenna Shimileski with ERA, Reardon Realty. And with Senior Saturday's topic is going to be caregiving from a distance. Now, many of us are away from our aging loved ones due to changing economies, changing careers, life choices, sky's the limit. And so it's hard for us when we have loved ones that are afar and that we can't be there physically present to help them day in and day out. So let's talk a little bit about the long distance caregiver. In 2015, there was a study done by the National Alliance for Caregiving that they realized 34 million adults were caring for an aging loved one. Um, 60% of the caregivers are female, and they are 49 years old on average. 85% provide care for a relative, and nearly half are caring for a parent or a parent in law. So, caregiving tasks. Normally, when you think of caregiving tasks, you're thinking of helping with daily activities like groceries, transportation to and from the doctors and running errands, paying bills, housekeepings, or maybe your loved one needs help with things like bathing, dressing, grooming, toileting, ambulating. Those are what we call activities of daily living. Um, so, by becoming a caregiver, that results in potential lost wages, lost Social Security income for down the road, um, pension. Some estimates claim about 3 million or more is lost annually due to caregiving needs. So if you are a long distance caregiver, you know that it's tough. Some great things have come on the path like Skype or FaceTime. And so that way you can at least see your loved one and they can connect with you that way. Um, but really nothing substitute for actually physically seeing them yourself. So a simple solution, if you can, would be great. Either you move towards your aging loved one or move them towards you. That happened quite a bit often when I worked in senior living. We would have residents either move away or vice versa. They were pulling their parents closer because they lived here. And so that was important to them. If you can't, this is what you can concentrate on. So things you got to focus on are what can you possibly do remotely. So research and find a reputable housekeeper, lawn care company, um, have routine visits. So ideally, it's going to be every 2 weeks on Tuesday, and she's going to come at noon. So your loved one can have it on their calendar, they can see it, they can remember by the visual aid when that person who's going to help them is coming. Um, Call their physician and ask to be able to get routine updates. Now, your aging loved one is going to have to fill out a HIPAA form for privacy in order to do that. Um, Another option is set up online banking, and perhaps your loved one will let you also have access to view the account just to make sure things are getting done correctly. Um, Set up a food delivery service. So there's so many it was really aimed towards millennials and professionals who don't have time to cook. This is also a great generation to be able to set up those home delivery systems. Or we are very fortunate in this area. Jackson County has a great Meals on Wheels program. I do hear from many seniors that the food is pretty good. And sometimes, even if the food there's too much in quantity, I'll hear that they'll freeze it and be able to reheat it later. So that's a great opportunity as well. So you'll definitely want to connect with our local Jackson County Department on Aging to get your loved one set up on Meals on Wheels. And that is not income based. A lot of people think that your loved one has to be low income in order to qualify, and that's not the case. All right, so other long distance caregiving tips: communicate often. Again, set up a schedule. Okay, mom, I'm going to call you on Monday, Wednesday, and Friday at 6:30, so you can anticipate my phone call then. Um, Visit in person as much as possible. I've got some family members that Mom is totally fine, but she is caregiving for her husband who has significant dementia, and it's a lot of work for her. Unfortunately, it's gotten to the point where he doesn't remember who she is. He doesn't remember the house that they're living in. He doesn't remember building that. And so the two girls kind of rotate and take turns, and so they've got a schedule on when they're helping. Um, Again, take advantage of technology like FaceTime and Skype. But there's also, not just like the Lifeline pendants. A lot of those companies also have some web-based security. Some of them have, the watch instead of the necklace. Some of them have sensors. So if somebody has taken a fall, it'll immediately alert the security and or maybe yourself before EMS is called and brought over to them. Big one. Come up with a list of all your what ifs that are going to be difficult. What if your loved one falls? What if they can't get out? What if there's a snowstorm? What if the power goes out? What if I didn't get my groceries for the week? Make a list and come up with a plan. Not only is it going to be comforting for your loved one, it's going to be comforting for you as well to know that there are things in place. Make a list of important names, family members, neighbors, friends, physicians, things like that. Make sure that you are up to date and keep copies. Everyone involved in the family have quick access to all the legal and medical documents. So power of attorneys, advance directives, wills, everything like that. You want to make sure that you have that. And number one, because this changes the most, current medications. That's always vitally important. So make sure you have a list. Ideally, even have the list on the refrigerator at home. So for some reason, God forbid, EMS is called, they can clearly see that here's a medication list. They can grab it with them as they're taking your loved one to the hospital. And so everybody can be on board with what's going on. Make sure you've set up a healthcare power of attorney. That is so important because if your loved one cannot speak for themselves, somebody needs to speak for them. Use your resources. You can contract with, again, lawn care providers. You can contract with transportation providers, somebody to take them shopping or go to the doctor. In-home care can help with that, even with their daily needs, again, if they need help with bathing, dressing, grooming, so on. There's also another opportunity. It's called a geriatric care manager. It is pricey, but it's worth it. If you can afford it, you actually have a nurse social worker come and make routine visits. And they're basically a professional relative, as I like to call it. So they can coordinate with the in-home care. Locally, they can connect with the housekeeping, so on. It isn't easy to be a long-distance caregiver. Things that are going to help are to be organized, gather and use all of your available resources and the technology as well. Focus on the positive. Focus on that consistent interaction. Your loved one is going to appreciate that. If you get to a point and you just don't know what to do, don't know how to help, trying to keep your loved one at home, or maybe you just know it's time to go to some sort of senior living community, assisted living, skilled nursing, maybe even a smaller adult foster care home. Call me, Jenna Shimoleski. Again, I'm a seniors real estate specialist. I have a lengthy history in senior living and healthcare. I know all the different communities and available support services in the area. I don't charge anything. I don't charge anything to the community. If you do move them in, I just do out of the kindness of my heart because I like to help people. So call me at 517-937-5232. Again, I'm Jenna Shimoleski with ERA Reardon Realty, and I hope you have a great rest of your weekend. Take care.